After 75, many people are told that feeling tired, forgetting things, losing balance or waking up at night is simply part of getting older. And while some changes do naturally happen with age, doctors warn that certain symptoms should never be brushed aside as normal aging, because they may actually be your body's way of asking for help. In today's video, we'll talk about 7 aging signs that may seem harmless at first, but could deserve medical attention if they become persistent, sudden, or severe. This video is not meant to create fear, and it is not medical advice. The goal is simply to help older adults and their families recognize when something may be worth discussing with a healthcare professional. And make sure you stay until the end, because some of the most overlooked warning signs are often the quietest ones. Now, let's begin. 1. Sudden or unusual fatigue. Many older adults naturally have less energy than they did decades ago, but doctors say there is a major difference between normal tiredness and sudden ongoing exhaustion that feels unusual for your body. If simple activities like walking to the mailbox, preparing meals, or getting dressed suddenly feel overwhelming, it could point to something more serious. Persistent fatigue can sometimes be linked to heart problems, anemia, sleep disorders, medication side effects, dehydration, infections, or nutritional deficiencies. What makes this symptom tricky is that people often adapt to it slowly. They may say things like, "I'm just getting old," while their body is quietly struggling with an underlying issue. One important thing doctors often look for is whether the fatigue appeared suddenly or gradually became worse over time. A major change in energy levels should never be ignored, especially if it comes with shortness of breath, dizziness, chest discomfort, or confusion. Aging may slow you down a little, but extreme exhaustion is not something you should automatically accept as normal. 2. Losing balance. More often, many people over 75 notice changes in stability and coordination, but repeated balance problems, frequent stumbling, or unexplained falls can sometimes signal much more than weak muscles. Balance involves the brain, inner ear, vision, nerves, muscles, and circulation all working together. When one of these systems begins to struggle, the risk of falling increases dramatically. Doctors often worry because falls are one of the leading causes of serious injury among older adults. A single fall can sometimes lead to fractures, reduced independence, or long recovery periods. What's especially concerning is when someone begins holding onto furniture while walking, avoiding stairs out of fear, or suddenly becoming unsteady in familiar places. Sometimes the cause may be simple, such as dehydration or medication side effects, but balance changes may also be connected to neurological conditions, blood pressure problems, vision loss, or inner ear disorders. Many seniors hide falls because they fear losing independence, but early evaluation can sometimes prevent a much larger problem later. 3. Memory problems that disrupt daily life. Occasionally forgetting names or misplacing keys can happen at any age, but doctors become more concerned when memory problems begin interfering with everyday responsibilities. For example, repeatedly forgetting important appointments, becoming confused in familiar places, struggling to follow conversations, or having trouble managing medications may signal something more serious than normal aging. Not every memory issue means dementia. In fact, poor sleep, stress, depression, infections, vitamin deficiencies, medication interactions, and hearing problems can also affect memory and thinking. One important warning sign is when family members notice the changes before the individual does. Sometimes, loved ones observe increasing confusion, repeated questions, or personality shifts long before the person recognizes it themselves. Early evaluation matters, because some causes of cognitive decline may be treatable or manageable when caught sooner. And even when memory disorders cannot be reversed, early support can greatly improve quality of life and safety. 4. Unexplained weight loss. Losing weight without trying may sound harmless to some people, especially after years of worrying about weight gain. But after 75, unexplained weight loss can sometimes be a significant medical concern. Doctors usually pay attention when someone loses weight despite eating normally or without intentionally changing their diet or activity level. This can happen for many reasons, including thyroid problems, digestive disorders, depression, medication side effects, difficulty chewing, infections, or more serious illnesses. Sometimes older adults slowly lose interest in food because meals become lonely, tiring, or difficult to prepare. In other cases, changes in taste and smell reduce appetite without the person fully realizing it. The danger is that weight loss can weaken muscles, reduce immunity, increase frailty, and raise the risk of falls and hospitalization. Even small changes in body weight may deserve attention if they continue over time. 5. Shortness of breath. During simple activities, getting slightly winded after heavy activity can be normal, but becoming breathless during everyday tasks should not automatically be blamed on age. If walking across the room, climbing a few steps, or speaking for long periods suddenly becomes difficult, doctors recommend paying attention. Shortness of breath may sometimes be linked to heart disease, lung conditions, anemia, fluid retention, or circulation problems. Some older adults adapt by moving less and less over time without realizing how much their activity level has changed. They may stop gardening, avoid shopping, or spend most of the day sitting simply because breathing has become uncomfortable. Another important warning sign is waking up at night, feeling short of breath or needing multiple pillows to sleep comfortably. The earlier breathing issues are evaluated, the more treatment options may be available. 6. Changes in walking speed. Doctors have increasingly begun viewing walking speed as an important indicator of overall health in older adults. A noticeable slowdown in walking, especially if it happens over a short period, can sometimes reflect declining muscle strength, neurological issues, joint problems, heart disease, or cognitive changes. Walking requires coordination between many body systems. When someone who was once active suddenly struggles to keep pace or appears unusually cautious while walking, doctors often pay close attention. Research has shown that walking changes may sometimes appear before other obvious symptoms develop. The key thing is not comparing yourself to younger people. It's noticing meaningful changes from your own normal routine. A slower pace may not seem dramatic at first, but it can sometimes be an early signal that the body is under stress. Swelling in the legs or feet. Many people assume swollen ankles are simply part of getting older, but persistent swelling should never be ignored without understanding the cause. Fluid buildup in the legs may sometimes be related to circulation problems, heart conditions, kidney disease, certain medications, or issues with the veins. Doctors often look for patterns. Does the swelling worsen throughout the day? Is it painful? Is one leg more swollen than the other? Does it improve overnight? Swelling accompanied by shortness of breath, chest discomfort, redness, or sudden pain may require prompt medical attention. In some cases, simple lifestyle changes may help. In others, swelling can be a clue that the body is struggling to regulate fluids properly. Because the symptom often develops slowly, many people become used to it without realizing it may point to a deeper issue. Growing older is natural, but ignoring important warning signs doesn't have to be. Paying attention to small changes early may help protect your health, independence, and quality of life for years to come. If you found this video helpful, consider sharing it with someone you care about. And don't forget to like, subscribe, and join us for more healthy aging tips and senior wellness content. Take care, stay healthy, and we'll see you in the next video.